So tonight we're going to talk about one of the substances. It's actually one of the most common substances that people develop problems with, and it's one of our legal substances. So we thought it was something that we would choose this year to talk about. Some of the things that we're going to address tonight, by the end of tonight, you might have a better understanding of being able to tell whether you or perhaps a loved one might have a problem with alcohol. We're going to talk about the relationship between alcohol use and mental health disorders. And we'll also talk about some treatment options that are available for those who may feel they have an alcohol use disorder, both for the individuals and for their family. When we think about substance use disorders, or we think about addiction, we sometimes have a picture in our mind of what that person looks like. And particularly when we think about alcohol use disorders, I think the most common thing that comes to mind is this idea of somebody who maybe is homeless, somebody who drinks hard alcohol from morning to night and is not really functioning very well. Alcohol problems come in many different presentations. And so we see a variety of different people, a variety of different ages, a variety of different patterns. And so someone with an alcohol problem may be a woman who has a good job, who every night after work drinks a liter of wine every night. It might be a young person in their 20s who binge drinks and recurrently gets into trouble drinking and driving, missing work, losing jobs, and things like that. So I think it's important to know that an alcohol use disorder can present in a lot of different ways, and it really does not discriminate. Alcohol use disorders are very expensive to our society. This was actually done in 2002, so I suspect the numbers would be much higher if there was a more recent study done. But it's estimated that it costs Canada about $14.6 billion per year as a result of alcohol abuse, or about $463 for every Canadian. When we look at hospitalizations, alcohol is responsible for over half of the cost of hospitalizations for substance use-related disorders. And the most recent numbers we have been published by the Canadian Centre of Substance Abuse from 2011 is $145 million per year. And we also know that over time we see increases in the amount of money that it's costing for these hospitalizations and the number of days that people are being hospitalized for alcohol use disorders. When we look at these studies, in fact, these numbers that we're getting are probably only the tip of the iceberg, because really what it's capturing is individuals who've been given a diagnosis of an alcohol use disorder as their reason for being in the hospital, when in reality, there's many other people that have been hospitalized due to their injuries related to alcohol use, due to liver disease related to alcohol use, due to cancers related or other types of injuries. And so the number is actually probably much larger than these numbers that we see from these studies. Unfortunately, most people who have an alcohol use problem end up not getting the treatment that they need. And I think there's a lot of different reasons for that. In some cases, it's the stigma. If you have a certain idea of what someone with an alcohol use disorder looks like, and that's not a very favorable image to you, then you might be very reluctant to seek help. Some people are in denial about the extent of their problem, and some people just don't know where to get help, or when they try to get help, it doesn't seem to go anywhere. So tonight we're going to talk about what normal drinking is. We're going to talk about what addiction is. And when we talk about normal drinking, the first thing we have to understand is what is a drink? Because we need to talk the same language in order to understand how do we know if somebody's not drinking too much. And so when I talk to patients, and I ask them how much they're drinking, their idea of what a drink may be very different than what an actual standard drink is. And so we have to talk that same language. And so how we define a standard drink is it's either 341 milliliters of 5% beer, or a 5-ounce glass of wine, or 1.5 ounces of hard liquor. And you'll see we have both, the American measurements and the Canadian measurements. But basically, each of those standard drinks is equivalent to 13.6 grams of alcohol. And so what that means is that if you're drinking a 750 milliliter bottle of wine, that would be about 5 drinks a day. If you were drinking a 1 liter bottle, that would be 8 drinks. If you're drinking a 1.5 liter, that would be 10 drinks. With beer, it depends on the size of beer that you're drinking. So if you're drinking that standard 341 ml can that looks like a pop can, then that's 1 standard drink. But when you start drinking maybe the 500 milliliter beers, that's maybe 1 1/3. And if you're drinking the 710s, that's more like 2. Okay. And if you're looking at hard liquor, your 375 milliliter bottle or your Mickey is about 8 standard drinks. A 26 ouncer is about 17 standard drinks, and a 40 ouncer is about 26 standard drinks. So that's how we kind of come up with what those numbers are. And that helps us figure out whether somebody's exceeding what we would recommend for general health, and also what their risk might be in regards to withdrawal. So we have our own Canadian guidelines of what we consider low-risk drinking. And these guidelines are intended for individuals aged 25 to 65. We'll talk about younger people in just a minute. And so the recommendations are that for women, that they drink no more than 10 drinks a week. So 10 of those standard drinks that we talked about, and no more than 2 drinks on on most days. For men, it's a little bit more, 15 drinks a week for men, and no more than 3 drinks a day most days. And why the numbers are different between men and women is women metabolize alcohol differently. Smaller amounts of alcohol affect our bodies more greatly, and we're more at risk of developing health problems using less alcohol for less periods of time. And so that's why the numbers are lower for women. It's also suggested that you plan at least 1 day a week that you don't drink so that you don't start to develop a habit. So that's recommendation 1. Recommendation 2 talks about reducing harm and risk of injury. And so they suggest that women drink no more than 3 drinks on any one occasion, and men drink no more than 4 drinks on any one occasion. Because as you start to get above those levels, you start to become more intoxicated, and there's more risk of injuries and bad things happening. Recommendation 3 is that you don't drink under particular circumstances. So you don't drink if you're driving a vehicle or operating heavy machinery. If you're taking medicines or other drugs that interact with alcohol, many times prescription medications have little stickers on them that say do not consume alcohol, and that's because of the interaction. If you're engaging in a dangerous physical activity, if you have a mental health or physical health issue that interacts with alcohol or alcohol makes it worse, it's recommended that you don't drink. If you actually have an alcohol problem, obviously it would be recommended that you not drink. If you're responsible for the safety of others, maybe you're taking care of your children, it would be recommended that you not drink during that time, or if you're trying to make important decisions. So that's recommendation number 3. Recommendation 4 speaks about pregnancy and breastfeeding. There is no known safe level of alcohol use during pregnancy. And so the recommendations are that if you are pregnant, or you're planning on becoming pregnant, or when you're breastfeeding, that the safest choice is to not consume alcohol at all. And recommendation 5 speaks to young people, so those people that are under that 25 age. And it recommends that you try to delay drinking until your late teens because your brain is still developing. And alcohol can harm the way that the brain develops. And that if you are drinking, that you follow alcohol laws and stay within those guidelines of number 1. So no more than 3 for men, no more than 2 for women, no more than 15 per week, and no more than 10 for women per week. So those are the Canadian low-risk guidelines. And if people stick to those, then really they should not get into trouble because of their alcohol use. They shouldn't get into trouble with their work. They shouldn't get into trouble with their relationships. They shouldn't have health problems related to alcohol. So we often kind of wonder, well, how much is everybody else drinking? And sometimes that depends on who your peers are and who your family, what kind of family you grow up in as to what your perspective is. But if we look at studies looking at the general population, this is a study that's done every 2 years by CAMH and looks at high school students across Ontario. So this is a local study, and you'll see numbers for. So this is for alcohol. So this is just that these individuals have consumed alcohol in the past year. So you'll see that as the students are older, a larger percentage of them have consumed alcohol at least once during the year. The binge drinking actually refers to, have you engaged in binge drinking in the last month? And so again, you can see that the numbers get higher as individuals get into the higher grades. But you can also see that it's actually not everybody. Because sometimes we'll hear, well, everybody binge drinks or everybody drinks. Well, no, actually, they don't. A fair number, 3/4 of grade 12s have had a drink in the last year, and 40% of grade 12s have engaged in binge drinking in the last month, but not everybody. Certainly not everybody has. This is another study. This is a Canadian study. That's a phone interview study that goes across Canada and the different provinces and asks people about their drinking. And in this study, so this is from 2012, of the people who were interviewed, about 78.4% said that they had consumed at least a drink in the past year. So that means about 21% of the population is not consuming any alcohol in a given year for whatever reason that is. And about 9.2% exceeded those chronic guidelines of not consuming more than 10 drinks per week for women or not more than 15 for men. And about 14.4% exceeded those acute guidelines. So again, certainly there are people who are exceeding those guidelines, but it's certainly not the majority. So if we talk a little bit about what are some of the harmful effects of alcohol, I think most of us probably know what it looks like when somebody has consumed alcohol. And you may see somebody who has some impaired thinking, some impaired judgment. If they consume enough alcohol, their speech may be slurred, their vision may be blurry, they may be off balance. This is why it's not a good idea to drive when you're intoxicated with alcohol. If you drink enough alcohol, your heart rate and your breathing rate can decrease. And particularly if you combine it with other sedating medications like painkillers, like opioids, or benzodiazepines like Ativan or clonazepam, if you combine those things, then you really increase your risk of decreasing your breathing rate and heart rate and even overdosing from that combination. Binge drinking, I referred to that in this high school study. So we define that as 5 or more drinks in a man or 4 or more drinks in a woman on one occasion. And what that really refers to is in somebody who doesn't have tolerance. And what tolerance is how alcohol affects you. So if you drink enough alcohol day after day after day, eventually, even though you've consumed a lot of alcohol, you don't appear as if you're as intoxicated as someone who doesn't regularly consume alcohol. Sometimes people brag about their tolerance, about how much tolerance they have and how much they can drink. And really, sometimes what they're really talking about is that they may actually have a bit of a problem. And so at these levels, these individuals are probably going to be intoxicated if they're consuming, if they're binge drinking. When they looked at that high school student study, we saw no differences between young men and young women. About 18% of students in the last month had had an episode where they had consumed alcohol and couldn't remember what had happened. And we call that a blackout. And what that has to do with is how quickly your blood alcohol level rises. So the faster your blood alcohol level rises, the more chance that there will be an impairment of your memory in which you may not remember the entire night, or you may forget little pieces of the night. In these young people, about 8% reported that somebody had been injured, and about 4% of them reported driving after consuming 2 or more drinks. Risks of binge drinking. So sometimes people who have developed an addiction problem to alcohol binge drink. Sometimes people who binge drink don't have an addiction to alcohol, but are putting themselves at risk of eventually developing an addiction to alcohol. Binge drinking can often result in problems in school, relationship, or work because people recover from that and end up missing work or school. Injuries often happen when people are extremely intoxicated, legal issues, sometimes sexually transmitted infections, unintended pregnancies, breast cancer, heart disease, and we spoke about this before, potentially death, especially in combination with some of the other sedating agents. I think I've spoken to some of the things on this diagram. But I guess some of the longer term effects of drinking would involve things like starting to experience damage to your liver, where your liver becomes impaired. Some of you may have heard of the term cirrhosis, which is a more serious damage to your liver. Sometimes people can develop problems with their pancreas, with their stomach, develop stomach ulcers. Blood pressure is often affected by drinking. People who have diabetes, they often have poor sugar control if they're drinking. So lots of other risks from consuming alcohol. So another risk with alcohol, and it's interesting because alcohol is one of our legal substances, but it's actually the most potentially life-threatening withdrawal of any of the substances that people end up developing a problem with. And in order to develop alcohol withdrawal, you need to be drinking on a regular basis, on a daily basis. Generally, the more alcohol that you're drinking, the more likely that you might have withdrawal symptoms. And alcohol withdrawal usually starts within about 4 to 12 hours of the person's last drink. Their most severe symptoms usually happen around day 2 or day 3. And usually alcohol withdrawal is completely resolved within about 5 to 7 days. The most common symptoms that we'll see that people's blood pressure elevates. We might see that they're sweating. We might see that they have a bit of a tremor. Their hands are shaking. They may feel very anxious, and they'll probably have difficulty sleeping. Some of the more severe symptoms that we might see with alcohol withdrawal would be people could actually experience a seizure, and that would look like an epileptic seizure where they would fall to the ground and their body would convulse. Elevated blood pressure and heart rate, which can be a stress, particularly if you already have heart problems. It can precipitate things like heart attacks. And then something called delirium that often will be a state where that blood pressure is elevated, the heart rate's elevated, the person's becoming confused, and probably actually would need an admission to an intensive care unit. As far as who's at risk of alcohol withdrawal, probably the best predictor is what's happened before. So if somebody has stopped drinking before for 2 or 3 or 5 days and they didn't have any withdrawal symptoms, if they stop again and are drinking exactly the same amount, probably it's going to be the same and it's going to be fine. But when people have had a seizure before, it greatly increases the risk that they will have seizures again when they stop drinking. The more you're drinking, the more likely that it is to happen. If you're having to drink from morning to night, often people don't just decide to start drinking in the morning. Often it's a response to they're starting to drink so much that when they wake up in the morning, they're in alcohol withdrawal and they're shaky and they're anxious. And so when people get to the point where they need to drink in the morning and they're drinking around the clock, then there's higher risk that they're going to develop withdrawal symptoms. If people have needed medication before or have had emergency room visits in order to withdraw, or if they do already have cirrhosis of the liver, that may put them at higher risk. I think the bottom line is what we say to people is it's probably best to talk to your healthcare provider, your family physician, or your nurse practitioner about your specific risk. The good news is that alcohol withdrawal is actually quite easy to treat. There's medications that we use, and like I said, alcohol withdrawal only lasts for probably about 5 to 7 days, so it's a pretty short treatment, and kind of your best first stop is going to be speaking to your family physician or your nurse practitioner.
Okay, so now that we've heard from Dr. Willows all the different things that can happen as a result of drinking, what is normal drinking, how much is everybody else drinking, what are the effects of drinking, maybe we can turn a bit to, okay, how do I know if I have a problem, or how do I know if my loved one has a problem? Because we've heard lots of statistics to kind of put this into place. But we've put together some questions that are actually based on some validated scales, which are basically measures that have been tested on thousands and thousands of people to compare one group of people to another group of people, and based on the score it can tell you how much risk you, or if you're doing this for somebody else because you have someone else in mind, or you're a healthcare worker who's here so you have some of your clients in mind, kind of puts that into perspective for you. So there's a series of 10 questions, and I put in the scoring so that you can rate yourself. So that means everything in this column is a 0. I'll read the questions in a sec if they're hard to see. Everyone in this column is a 1. I can do a straight line. Everyone's a 2. This is a 3, and this is a 4. So if you want to keep it in your head and do it as we go, great. If you don't want to do it as you go because your neighbor's beside you, or it's hard to keep all these numbers in your head because once you get to 5 or 6, and then we turn to the next slide, you got to add like 3 or something. It gets a lot. There's this, we're going to show you an app at the end that you can go online and you can do this yourself in your own privacy and have it all added up for you. So the first question is, how often do you have a drink containing alcohol? So it's on a scale of never to 4 or more times per week. And then you'd give yourself a score of 0, 1, 2, 3, 4, depending where you score yourself in the box. Does this make sense? Nod? Excellent. Okay, so the next one is, how many drinks containing alcohol do you have on a typical day when drinking? Again, 0 to 4, depending where you are in the box, which goes from 1 to 2 or 10 or more. How often do you have 6 or more drinks on one occasion? As you remember when Dr. Willows was talking, she talked about, people who are daily drinking 6 or more drinks being one of the risk factors. So this is mirroring what we know from clinical practice. The fourth is, how often during the last year have you found that you are not able to stop drinking once you've started? From never to daily or almost daily. The fifth is, how often in the last year have you failed to do what was normally expected of you because of drinking? Again, from never to 4 or more times a week. Because one of the signature symptoms of alcohol use problems is its impairment of your social and work and recreational functioning. So that's where that one's coming from. The next one is, how often during the past year have you had a drink in the morning to get yourself going after a heavy drinking session? Again, this goes very nicely with Dr. Willows was just talking about in terms of the reasons people start drinking in the morning, that it's, again, just to reinforce, not for the reason that they want to start to have a drink, but more to deal with some of those initial withdrawal symptoms. The next was, how often during the last year have you had a feeling of guilt or remorse after drinking? From never to daily or almost daily. When we talk to our patients who are struggling, sometimes they just feel so guilty. They feel so bad. They couldn't believe what they did when they drank. And maybe you or your loved one or your clients have had experiences with that before. Number 8 was those blackouts that Dr. Willows talked about. So how often during the last year have you been unable to remember what happened the day before because of your drinking? Again, that goes from never to daily or almost daily. Number 9 has to do with the results of physical injury. So have you or someone else been harmed because of your drinking? So a car accident, falling down the stairs, maybe tripping or, and breaking your arm or breaking your ankle, which would often be a common presentation we see people go to the emergency room for. It's the breaking of the ankle, but it's the breaking of the ankle because they may have had a bit much to drink. Number 10 is, has someone told you, a relative, a friend, a doctor, your health professional, did you have a question for me, or you're just, okay, has been concerned about your drinking or suggested you cut down? And the score of this is 0, 2, and 4 for these last two, because remember, it's all, I did it so it's all zeros, all ones, all twos, all threes, all fours. So I'll tell you what that means. Can I move along? Nods? Okay, perfect. So what does it mean? So if you scored 8 or more, it's in a category we call harmful or hazardous drinking. So it's not necessary that you may meet the criteria for alcohol use disorder, but what it likely means is that that your drinking can actually be at a level that can cause harm or hazard to you or somebody else. So it's a bit of a call to say, hey, maybe this is more of a problem than I thought it was. The next is, and remember for the differences of drinking guidelines between women and men, we mirror that with the different scores for women and men. So if you score 13 for women or 15 or more for men, it indicates likely alcohol dependence. So an alcohol use disorder, which is what I'm going to talk about in a couple minutes. So really that problematic pattern of abuse that's affecting your functioning, it's affecting your health. You try to cut down but really can't. You have those tolerance that Dr. Willows talked about and withdrawal. So I want to caution, this is a score that you did when you were in auditorium, a self-report test. So nobody please leave running all nervous that they got a 16 or a 4 or whatever it is. It's a screening tool. So the goal really is just to get yourself reflecting and thinking about it. So if you have questions, go talk to your doctor, talk to your nurse. There's lots of resources out there, and we'll show this to you at the end. But really, it's to be part of a conversation. This is not a diagnosis, so please don't leave and say, I heard these presenters, and they told me I scored 14, so I have an alcohol use disorder. That really wasn't the purpose. So remember I said, if you didn't feel like doing this in here, if you want to think a bit more about this, and how do my scores compare to other people? How does my drinking compare to other people? Am I having a problem? And want to look at that. Ottawa Public Health has created this fabulous website. And I put the URL, that's the fancy word for this website address. So it's www.2, I guess, checkyourdrinking.net. And basically it's an 18-question survey, very much based on those questions I just showed you up here. And you can answer anonymously. You can answer for yourself. You can answer for someone else. You can answer for a made-up person just to see what it is. And at the end of it, you can actually put in an email address or some contact information. It can get forwarded a report, actually. And you can see sample reports to know what you're going to get to begin with. And the report can either go to your health professional, it can go to yourself, you can read it online, and it really just gives you some, starting that conversation about how do I compare to others, how much am I drinking, do I have a problem, and what can I do about it? So I encourage you to check that out. And as Pam, our moderator, had said today, all these slides will be posted on the internet, so you can do that. You can also Google Ottawa Public Health alcohol, and I think it's like the second thing that comes up on the Google search. So this leads us to, what about addiction? Not everybody who drinks, not even everybody who drinks maybe more than the normal guidelines necessarily is struggling with an addiction. So we want to draw that conclusion, going from what is normal drinking to how do I know if I'm drinking too much, to what are some of the severe implications of drinking, to, oh my goodness, I think I meet criteria for that alcohol dependence. So let's talk a little bit about addiction. So addiction is really a developmental disease that starts in adolescence and childhood. And again, this goes back to that first slide Dr. Willows showed us, right? When we think of somebody with an alcohol problem, we're often thinking maybe of that street-affected person who's really struggling with drinking morning to night, isn't working, and is really not functioning. Actually, a lot of this starts, especially addiction, really starts in young people. So we're looking at actually the average age of initiation, depending on the study you look at, anywhere from 14 to 16. And I put this up because I think it's really important. We often think about alcohol use problems or substance use problems as something that people choose. I've been doing this quite a long time. I have never, and my colleague will agree, ever in all these collective years of 30 years of doing this, ever known somebody who said, yeah, you know, that's what I was going to be when I grew up. And it sounds a bit funny, but I think it's important to think about that. This really is a disease. It really is a condition, just like diabetes, just like heart disease, just like all the other chronic illnesses that we see. The same way nobody chose them, nobody chose this. And when we think about the disease of alcohol, it really is a disease of the brain, circuitry, reward, and motivation. And it's characterized by some of the things that we saw on those scales and that you heard at the beginning of the talk. The inability to control, impairment in behavioral control, craving, not really recognizing one has a problem with their behavior or their relationships, and their dysfunctional response to that. And that's the fancy definition from the American Society of Addiction Medicine that we use. And like other chronic diseases, like diabetes, addiction often results in cycles of relapse and remission. So what that means is, we often search for, if people just stop drinking or if they just manage the addiction, it'll be gone, and that's it. That's not really how we think about addiction. You can have remissions, which means it's a big word for stops, for, it's under control for a period of time, but then we have relapses. That's actually the natural cycle of addiction, and that's the natural cycle of alcohol addiction. It's progressive, and it can often result in disability or premature death. So we really need to conceptualize this as a disease, just like any other chronic illness that people struggle with. We talk about the 4 C's of addiction, which are craving, control, consequences, and compulsivity. So craving means that yearning for the substance. Control is that loss of control, impaired control. One, not being able to stop once they start, despite their best attempts. Use despite consequences. So if somebody has that liver disease, cirrhosis, or has mental health problems where their alcohol makes it worse, continuing to drink despite knowing the psychological or physical consequences that it has, and compulsivity, continued drinking and that compulsion to drink. So that's addiction. And we throw that around as a term, and that's really what it means. But addiction is actually not a mental health diagnosis in where we get the rest of them. So we use this manual called the DSM, the Diagnostic and Statistical Manual, where we can find all sorts of diagnoses, like mood disorders, which is things like depression, anxiety disorders, which is panic disorder, anxiety, or obsessive compulsive disorder, schizophrenia and other disorders of thinking and perception. And in that is also a section for substance use disorders. So it's actually in that very same manual where we diagnose all the other sorts of mental health problems that people deal with here at the Royal and in community programs and your family doctor, etc. So alcohol use disorder is one of those types of substance use disorders. And as I mentioned, when you can see here on the slide, it's very similar to the symptoms that we've talked about already. So it's that problematic, clinically significant impairment. So that means there's problems in functioning, problems at work. Alcohol causes problems with maybe your recreation activities, your social activities, that impaired control that we talked about, inability to stop even when you try, drinking more than you intended to, craving alcohol, risky use, so that's that using despite its effect on your physical and psychological conditions, and pharmacological, which is that tolerance, so needing to drink more and more to get the same effect, or not getting the same effect with the same amount of alcohol, as well as withdrawal. And Dr. Willows went through all those symptoms of withdrawal, so I'm not going to go through them again. So depending on how many of those criteria you have, there's 11, you can see the numbers in each category, you either can have a mild alcohol use problem to a severe problem. So if you had 2 or 3 of those criteria when you met with your doctor and that's what they thought, you'd have a mild problem. If you had more than that, you could have as much as a severe problem. So what are the risk factors? And it says substance use problems because alcohol, again, was part of those substance use disorders. So this you could use for interchangeably any of them. So you have this addiction here at the middle, but where does that come from? It's multifactorial, which merely means it's not just one thing that leads to it. It's a suite of things. So we have this vulnerable host. So that means the person, you, if you have a history of genetics of drinking or substance use problems in the family. Then there's more likelihood of having an addiction. If you have a mental health problem, which we'll talk about, which are very, very common, 1 in 5, as you know, is the statistics. So if you have depression or anxiety specifically, that puts people at higher risk for addiction. Early childhood experiences of trauma and violence maybe when they were growing up. The next, and that also falls into the environment or sociocultural context. People use what's available. So if one's with a cohort and peer group or family where drinking is really normal or there's a lot of that, people are more likely to do that. And the third is repeated substance use. Remember when we went through those low-risk guidelines that talked about calculating non-drinking days so that you didn't develop a habit? That's because of this. The repeated use puts one at risk of addiction. If you only drink once a week, follow those recommended guidelines, you're likely not at risk. But the more you use and the more that becomes your pattern, the more likely you are to have an addiction. So you put those 3 things together and that puts you at risk. So alcohol and mental health problems, seeming like 2 very opposite things, but actually quite more connected than you can think about. So we talk about concurrent disorders, and when Pam introduced us, she said we were from the Substance Use and Concurrent Disorders program, which sounds like a mouthful. Concurrent disorders really refers to people struggling with mental health problems, substance use problems, as well as physical health problems. And those go together to come up with that equation for concurrent disorders. And they're actually the rule, not the exception. We often think as mental health being one thing and substance use or alcohol being another thing, but for the majority of people, they're actually quite related. So we know that people who have alcohol use problems have higher rates of mental health problems than the general population. And the corollary of that is true, that people with mental health problems have higher rates of alcohol use problems than the general population. 37% of people with an alcohol use disorder will actually have a mental health disorder at some point in their life. And here's what the rates look like, because I think I talked about how anxiety and depression are most commonly related to alcohol use. So this is a study that was done, it's actually US data, and it looks a bit older in the past 18 years, but there's actually very little new data out there other than confirming this, and this was the largest study, so this is what we tend to report on. So you see here on the left, it talks about the mental health disorder. Then you have the individual. So you have men over here and women here, and it's separated into percent and odds ratio, which I'll explain in a second. So you'll see of those with an alcohol dependence, 36% of men have an anxiety disorder versus 60% of women. When you look at mood problems, which is things like depression, almost 30% of men struggle with a mood problem versus 54% of women. And these odds ratios are referring to the general population. So if you have alcohol dependence, you're 2.2 more times likely if you're a man to have an anxiety problem. And if you have alcohol dependence and you're a woman, you're 4.4 times likely to have depression. Does that make sense? So why is this? Why does this happen? Why are they related? What's the chicken, what's the egg? Does alcohol come first? Does the mental health problem come first? What's related? Well, there's many theories for why they're related. One is that they're directional. So if you're struggling with an alcohol use problem, you may end up having symptoms of depression. You have a lot of loss associated with it. There's a change in your physiology, which can look like depression. Or if you're depressed, you're feeling so awful, it's pretty common sense. People may just drink to cope with their depression because they're really not sure what to do. The treatment they're getting is not helping. They're not able to get treatment, so they self-medicate. Or there's the bidirectional, which means you drink, and then you're depressed, and then the more depressed you are, the more you drink, and then the more you drink, the more depressed you get, and you can see how it goes. There's many theories, but when you take a step back, it actually does seem quite common sense that these are together. Yet, unfortunately, they're not in many places often treated together. But what we do know is if we want to treat them successfully, we don't want to treat them separately. So we don't want our patients to go, or those of you who are struggling, to go to one place to get help with alcohol, and then when that's done, go somewhere else to get help with depression or anxiety. The gold standard is to actually treat both concurrently in an integrated fashion, which gives people the better chance of success. And it's also well known if we catch your mental health problem, your alcohol problem early and treat it early, one has a better chance for good outcomes and a better and fuller recovery. So what do you do with all this? What if you think after listening to this presentation, or maybe that's why you came, because you think you or a loved one has a problem or your clients are struggling and you're not sure where to send them, what is it that we can do? I think the first thing we need to do, especially if it's our loved one or even ourselves who's struggling, to understand that change is a process. It's not that something that happens overnight. We talked about addiction as this relapsing, remitting, chronic illness. We also know that not everybody who's struggling with a problem is ready, willing, or able to make changes. And if we're trying to support someone going through this, you know, the television shows you see about coming down hard on people and yelling at them and having an intervention, not very effective to get people to change. In fact, wouldn't highly recommend that. Makes for good TV, and that's probably about it. So we need to recognize that people are on a change trajectory when they make changes. So I'll explain this. So in here is where people often start, and you go right around this way. So pre-contemplation is the middle one. Many people are either not aware that they have a problem, not think they have a problem, and not ready at all to even talk about it. Oh, sorry. Contemplation is the next stage of change, where people move towards feeling an ambivalence. They see as many reasons to make change as not, but they feel a bit stuck. Think about, we take alcohol off the table, if you've ever thought of joining an exercise program. So if I told you how to go to the gym every day for 7 days and exercise for 45 minutes despite everything else going on in your life, most people may say, sounds like a good idea, but I don't really know if I can do that. So it's just really how we change behavior. The next is preparation, where people are feeling more ready, willing, and able to make those changes and foresee doing that in the next months and have a commitment to making the changes. And then action, they're making changes, and maintenance, they're sustaining them. We need to appreciate that change is a cycle. It doesn't go in a nice, clean line. We take as many steps forward often as we take steps back. And it's hard. It's hard for a lot of reasons. And people often cycle and recycle through these stages about 4 to 7 times. People make 4 to 7 serious change attempts before being successful. So we need to conceptualize when us or our loved ones try to make healthy lifestyle changes, like changing our drinking, our smoking, other substance use, whatever we're working on, that if it doesn't work, it doesn't mean we failed. It's just part of change. So what can we do in the interim? So how can we reduce at least some of the harms associated with drinking and engage in safer drinking? So one is try to set limits and stick to them, and that can help drinking from becoming a habit. To drink slowly, so every 3-hour period only have about a couple drinks. Maybe for every drink of alcohol, have a non-alcoholic drink. Separate your drinks with water or a glass of water in between. Eat before and when you're drinking. And consider your age, body weight, gender, all the different factors, your physical health conditions that may go into that these low-risk drinking guidelines were for all Canadians. It wasn't broken down by subpopulation. So people who have serious liver disease would not be recommended for men with serious liver disease to still have 15 drinks a week. So keeping that into account. And reduce the risk of harm. So drinking and driving, operating heavy machinery, doing complicated physical tasks, deciding to go up on the roof and retile the whole thing by yourself with a case of beer, those kinds of things. And you laugh, but these are things that people do and accidents really do result. So that's why, and not everyone who falls as a result of drinking has an addiction or has an alcohol use disorder. So even engaging in any of these harmful ways of drinking can result in harm. So, and what treatments are available? It would take me quite some time to go through every treatment available that's possible in Ottawa. So I'm going to go through some general categories of evidence-based treatments that can help, and then we'll talk about some more specific services. So one is with withdrawal management. Dr. Willows talked about medical withdrawal management for alcohol. There's other types of withdrawal management services, and basically those are just helping manage the withdrawal symptoms associated so you can reduce your drinking in a safe way. Next is medication. There are medications for alcohol use disorders that have been found to be effective, and there's medications for mental health problems like depression and anxiety that are effective. Mental health treatment is another big one. As I mentioned before, treating the alcohol use problem without treating the mental health problem at the same time makes it very difficult for one to be successful with their alcohol use treatments. So getting mental health treatment is important. Physical health treatment, there's talk therapies that are up there, which are things like cognitive behavioral therapy, motivational interviewing, which are evidence-based treatments for helping people manage their alcohol use problems. There's self-help groups like AA, and there's also these services happen in many places. They're in community programs, they're in hospital programs, there's outpatient program, there's intensive day programs, there's residential programs, which are like rehab programs where you'd go for a period of time and be every day. There's post programs, there's many different types of treatments and services. So really, if you think that you or your loved one has a problem, talking to your doctor and nurse to figure out, is this a problem for me? And opening that conversation with them, and then trying to work with them to figure out where's the best place to go for help, as opposed to running around trying to figure out what's best for you. So the services, as I mentioned, working with your primary care team is the ideal place to start. We also have a program here where my colleague and Pam and I are from, which is the Substance Use and Concurrent Disorders at the Royal. We have many treatments and services. We have a residential program. We have, which is a 28-day program. We have a inpatient program for medically managed withdrawal and stabilization unit. We have outpatient services. We have day clinics. We have post-treatment services. We have all sorts of groups and therapies. I won't go through them all here and now, but basically there's a variety of services that are offered here. And our program, again, integrates both that treatment for the substance use or alcohol problem as well as the mental health treatment. So people get both at the same time with us here. There's the Auto Withdrawal Management Center, which is over on Montreal Road, and they have services both for non-medical management withdrawal beds that are available, as well as they have other sort of community withdrawal management as well. There's OARS, which is the Ottawa Addiction Assessment and Referral Service, which basically, if you've talked to your family, So can I answer that at the end? Otherwise, we're going to start the whole question period, and I may answer your question as we go. So thanks. I'll keep it in my head. As I mentioned, OARS, and that is a bilingual service. And we have, here at the Royal, we have bilingual service. In fact, I'll answer your question now. These three, I don't know about everyone's family doctor or nurse practitioner, but I assume if you have one, it would be in the language of one's choice, hopefully. But we, withdrawal management and OARS, are all offer bilingual services in most of the sections. So OARS is a place where you can go if you've talked to your family doctor or other health professional, and they said, you know what, maybe you do have some concerns, maybe talking to somebody about where the best place to navigate to and the best service for you, you can meet with one of their team members, and they can meet with you, ask a bunch of questions, and help direct you to some of the right resources and point you in the direction. As I mentioned, there's also self-help meeting like Alcoholics Anonymous and Smart Recovery. Addictions and alcohol use problems doesn't just affect the individual struggling, it is a family disease. So many of the family members struggle, and we encourage the family members who are in this room, or if you know family members, even if their loved one doesn't want to get help or isn't ready to get help at this moment, to go get some help themselves. And there's lots of resources for that too. At the Royal, we have family information sessions that are led by our social worker, Ori, and they're every 6 weeks, I think, on Wednesday evenings. I can tell you the next one is on December 2nd, and they're here at the Royal between 6 to 8 o'clock, and it's open to everybody, just to show up. Yes, I'm getting nods, good. There's also family groups. So there's Al-Anon and Al-Teen, which are family support groups. Rita Wood is a community service. It's called Rita Wood Addiction and Family Services, and they actually have a family member program there to provide education, crisis support, and counseling. Serenity Renewal is a community-based service for mental health and addiction counseling for family members and parents. And again, if you're not sure, and especially if you're from the counties, I haven't represented this well here, because again, I'm not going to go through all the tons of services that are available. You could talk to your family doctor, nurse practitioner to point you in the direction. So I just want to end with the many faces of those struggling with alcohol use problems, so you could see that it is more common when we think, that we can help reduce the stigma by when someone's struggling, the language that we use, how we try to help them, and how we try to support them, and to encourage you that after this talk, or even maybe that's why you came to this talk, that if you think you're struggling or if you're concerned about something, that to talk to your health professional to see how you can do, because there is hope and there is treatment and there is recovery and there's lots of voices about that can show you that. So thank you.